Well, good afternoon, everybody. Welcome to today's Business Spotlight. I'm your host, Todd Rodden. I'm a certified executive and business coach. I own Aspire Action Coach based here in the Cincinnati and Dayton, Ohio region. Thrilled to have you join us today. If you're new, we encourage you to hit subscribe and you see future messages because you're going to love this message today with Erin Hazelbaker. Really story of a business really kind of moving forward, providing kind of newer, higher touch healthcare systems for folks, but also ways for businesses to be more efficient with their healthcare spend as well. So, uh, Erin, welcome to the Business Spotlight. We're thrilled to have you. Again, Erin is the CEO of Victress Health and Wellness, based here in Western Ohio, and she's going to talk about their services and their rapid growth. So, with that, Erin, take a second, introduce yourself, tell us a little bit more about Victress.
Yeah, thanks, Todd. I really appreciate having the time to be able to just continue to spread our message. So our message is one of hope. We know that, when we go in a room full of people and we say, okay, who in this room has had a crappy healthcare experience? It's inevitable. We get almost everybody right with their hands raised. So we're just excited about the prospect of bringing health back to, caring and just really providing people with what they used to have back in the day, which is just the ability that their doctor knew them. Their doctor could walk into their house and they knew exactly where Aunt Sally was laying on the bed. They didn't have to ask. They knew their dog and they would pet him on the head. We're kind of bringing that back. We're bringing back that feel, but we're using modern technology to do it. So we're using higher level testing. We're focused on more root cause approach. It's not just a pill for an ill. It's just really kind of taking the time with the patient and getting to know them and kind of focused on that patient and where have they been, and where are they going. See, what we've lost is when Aunt Sally comes to see us and we understand that her dog passed away 6 months ago, and that was a huge part of her heart, and she's suffering. When we understand that and we see that, it helps us to be able to treat the patient much more effectively than if it's just another person, another line, another 5-minute visit with everybody. So that's really where we hope to kind of start to continue to change healthcare, and just one patient at a time.
So maybe kind of build upon that.
Sure.
You know,
Yep.
who would be your ideal customer? So somebody's listening in and say, "Hey, that's a great solution for
Right.
us."
Yeah, so I think really to begin with, we're not the ones that started with this model. We have so many just amazing physicians to build on. Direct primary care is really the model that we found or saw that was such a great solution. So direct primary care just means that you pay a monthly fee and you get access to us at any time. So what used to be, just that normal, relationship that you have with your provider, now that provider caps the amount of patients that they take in, and they get to know each one of their patients. So we love referring to Dr. Amy Meckley out of Cincinnati. She really is the one that has helped us to kind of get started, build and continue to grow this model, because she's one of the original direct primary care providers. But as we started talking with folks, and we're building this model and we're having patients come to us that are sick and just not feeling well, it was like, gosh, we still aren't reaching the folks that we really want to reach. And that's when we started reaching out to employers and really showing them the benefit for their team of doing this. It's not just beneficial for the CEO. It's just as beneficial for the guy that's working in the shop or the guy that's, roofing your house. It's beneficial for everybody across the board. And so when we start kind of laying that out there, okay, well, what does that mean? Well, it means that we can save you a lot of money on your healthcare spend. And we've got so many numbers to back that up. Just here in Shelby County, we had such an awesome year last year. We knew that we were saving people money, but when renewals came back in and just seeing the numbers, add up of, their healthcare is lowering in cost. It's not continuing to rise. So all those things just really kind of add up. So who we really look to partner with are employers that are sick of just seeing every year that insurance renewal going up and up and up and up. And they feel like it's a fixed cost and they just don't have any control over it. And we're here to give you hope and say, no, there are things that we can do about it. So I know that was kind of a roundabout way of answering that, Todd, but I think it's important that you understand that, it's not just us, willy-nilly, out here. We're on the backs of, thousands of other direct primary cares that are doing the same thing.
Hey, thanks for sharing that background. I think
Yeah,
really key out there. I hope folks, you really got that takeaway because so many business leaders you talk to, you said they assume healthcare, it's not just even it's a fixed cost. It goes up every year, no matter
exactly.
what.
Hmm.
It's kind of an
Hmm.
uncontrollable
That's right.
kind of factor. Hey, I'm busy juggling all my other elements of inflation and
Yep.
whatnot.
Yep.
And I just got to take it. And no, you don't actually. And also, it's not only opportunity to reduce costs, but provide a better level of care and support to your
That's right.
employees, which can be a
That's
competitive
right.
advantage there as well. So,
Yeah, and that's really what we're seeing too, is that these employees for the first time are able to actually, kind of address some things that they've always kind of, hidden or, not been able to address. Couldn't afford it, and so they can come to us and everything that comes through our doors, your health plan doesn't really know about, right? So that's the advantage for folks is like anything that comes to us, we're not billing your insurance. It's just a relationship that we have with the employee. And then, as the employer, you're paying for that membership, but that employee then can see us for, stitches, for strep throat, all the things that would normally take somebody to an urgent care or an emergency room, most of those things can come through us. So we always like to say that between 85 and 90% of healthcare should be managed in a primary care's office. But because of this convoluted, crazy system that we have right now, what we're seeing is that much less of that is happening. Part of it is because of, folks are just like, I don't know, I can't afford to go to the doctor. So they wait and they wait and they wait. And all of a sudden it is an emergency and they need to go to the emergency room. Part of it is because, people don't understand the medication that they're being prescribed. Well, I don't want to take that. I'm not going to do that. And so then they don't. And so then they end up in the hospital. And so there's lots of little steps that we're just missing overall in the healthcare experience that when we can stay on top of that, we can cap those costs, for the employer groups that we're working with while providing great care that their employees love. One of the things that we love to hear too, Todd, is employer groups will say, I just don't think our guys are going to use it. And we love going in there and, having these employees who are saying, hey, my sister and I just did one not long ago. This guy says, hey, I've lost 70 pounds. I was supposed to be on this drug for rheumatoid arthritis. I decided I didn't want to do it. So I lost 70 pounds. I've really gotten some things, tweaked, but I'm still just kind of missing some stuff. And I just really would like some help with that. Can you guys do that? And it's like, oh my gosh, yes, this is amazing. We're so glad. But these are guys that are avoiding conventional medicine because they know what's going to happen. They know that they're just going to get put on a pill or, oh, don't do that diet. And it's like, what's that based on? Right. And so that's where we feel like we can come in and kind of fill that niche. And those folks, they're wanting it. They love that they can come in and talk to us about those things, things that they're hearing on, Joe Rogan's podcast or Andrew Huberman's podcast or, some of these guys. And so it's been really kind of cool to see that. And then also the shop talk, right? They're guys that are just around. They're like, oh, I don't know if I'm going to do that. But then they hear that, oh, Joe really had a great experience. And then they decide to go later, and so we love that too.
okay, great. So kind of building upon that, great
Sure.
examples, by the way. Thank you. So building upon that, what is it you wish more people knew about what you do?
Yeah, I mean, I think what it initially always comes down to for folks is, oh, that's an added cost, right? Um, and so what we love to do is just show them the ROI. And so the ROI is out there. You can look at, there have been so many studies that have been done. The most recent one, I believe, had 200,000 lives that were looked at, And so when we add in this direct primary care model, again, feeling like an addition, they were able to save $2,400 per employee per year. So it's like not just the cost of that. You're able to save that on top of it when you add in this direct primary care model. So super results, we're again, you don't have to just hear it from me. We can give you any of the employer groups that we work with that be happy to explain to you, how beneficial this is, for them, for their team, And again, this is nationwide. We're looking at this model being, it's nationwide. When we have larger employer groups and they say, oh, but we're not just in Western Ohio, we're also in, Indiana or Kentucky or California. That's great. We can find a DPC doctor that's close by. So that's the cool part of this model too.
So I'm curious on your journey so far,
Yeah.
what have been your keys to growth, like a in particular type of marketing channels or initiatives that generate the
Yeah.
most for you?
Well, I think really, Todd, we're just kind of speaking to these individuals that are getting just hit pretty hard right now with tariffs. The unknowns, are the tariffs, are they going away? Are they staying? They're kind of looking at all these costs that are, fluctuating so much and they're panicking. And so we're able to say, hey, man, wait a minute. That number two cost that you have, number one is the salaries, and number two is healthcare and benefits, right?
Mhm.
We're able to help you with that number two cost. Can we lower that? Because it's something you've always thought was fixed and it's not, or like you said, Todd, just continues to go up. And so that's actually been really helpful to explain to them, like, no, this is something, there is something you can do about that. So we'll contract with local brokers. We can help folks find, good insurance policies that will kind of help wrap around this DPC model rather than kind of seeing it as an addition. That is something that we can do, but that's a call for another day, Todd. I mean, there's so much that we can do to help with that, but if you're confused at all, this is, you're looking at the right group of people if you're looking at a DPC group, because they're going to be able to help you to figure out what would be next steps, for your business with that.
Okay. Thank you. So I'm curious, every business leader's life as an owner has twists and turns, some hills and
Yeah, sure.
valleys. I'm curious of a past challenge that you and the team have overcome, and what did you learn from it?
Sure. Yeah. Well, when we first started out, we are, my sister and I are physical therapists by trade. And so what we started out doing is, okay, people just are not getting well fast enough. And that's really how the business was born. Is like, I think we can do it better. I think we can
Hmm.
make this better. I think we can make this a better experience. I think we can help more people. So we started out that way. We went ahead from there and we kept getting patients asking questions about, diet and nutrition. And so from there, we added on something called functional medicine. We all got trained in functional medicine, just these high level genetic testing or microbiome testing, all these things that, insurance just won't cover, but it's so helpful and advantageous. And there's a lot of great research behind it. But as we added that on, what we realized is, folks were spending thousands and thousands of dollars on these tests and on working with us. It's like, man, most of these people could get better with great primary care. So as we kind of grew and kind of were adding on different things, I think that was the biggest hurdle for us is where do we put our time and attention? It's like we started out as physical therapists and we love physical therapy. We think it's so advantageous for folks, but then, it's like, do we put more attention into, the functional medicine side? Now, wait a minute. Do we put more attention into the direct primary care side? And so really just kind of seeing where our resources and attention needed to be spent has been a big challenge. It continues to be a challenge because now we have nutrition. Now we have, again, that functional medicine testing area. Now we have, all these different aspects of what we do. We also have our own supplements here because we're tired of people going and buying junk off the shelf at their local local grocery store. And so all of those things have been challenges as business owners that we've kind of been, just kind of using our CFO's input, but also just kind of following the money and also, where the trends have gone too, right? So like right now, it's a really good time for us to be pushing with employers like, hey, there's something we can do about this, rather than just kind of marketing ourselves as physical therapy or, functional medicine providers. So I think that's been our biggest hurdle.
Okay.
Yeah.
And as you look forward, you expect
Yep.
that to continue to be the biggest hurdle, or do you see some other things coming down the horizon?
No, I think as we continue to grow, as business owners, I'm sure, lots of folks have spoken to this as they've talked to you before, Todd, too. But as we continue to grow, we are putting in new locations, north and south of where we are currently. And as we do that, really those procedures. I don't want anybody from this clinic to have to stay full time at this next clinic to really have them understand our core values and kind of get the feel of exactly that patient experience that we want to have every time somebody comes in. All those types of things that we really need some help kind of nailing down those processes and those procedures. And so that's been a big hurdle, as we go to grow, is kind of making sure that we're lined up and fully ready for those clinics to open. So we're really excited because we feel like we've kind of started to nail that down. But that's been a big hurdle too, with growth, and that'll continue to be a hurdle. We don't have a problem finding, great hires. People are desperate to do what they got into healthcare to do originally, which is
Yeah.
to take care of patients. They're desperate to be able to do that. So we don't have a problem finding just amazing providers and, nurses and nurse practitioners, physicians. Like, that is not the issue for us. So we're very blessed in that way. It's not a hiring issue. Now it's just how do we make sure that every location that we have has the exact same feel as this original location that we have.
Well, I love talking to you. You're the first person I've talked to, and I can't remember how long I said it's easy for me to find great people.
Yeah,
So
yeah.
that's good.
Right. No, really, I know. I mean, it's just, healthcare is just one of those things right now where people are just desperate to do what they got into healthcare for. I was telling Todd, before we started, I just was interviewing with a nurse, and it just reinvigorated me. She said, I'm just so sick of, when I go into the hospital and I'm like, man, why is this person on 20 or 30 medications? Like, where were we? Where were we 5, 10, 15
Yeah.
years ago when they started down this spiral of being on all these medications? She said, I'm just so sick of that. I'm like, oh, welcome to Victress.
And there you
This is
go.
what we do for a living. We try to reach these folks and help them to see what the impact is of adding that first medicine and then the second one. So it's just reinvigorating every time that we get to do an interview. It's like, oh, people are just desperate for this.
So, so I'm curious, you mentioned adding some other locations. What's
Yeah.
your longer term dream vision for the business?
Yeah, so our vision is that Victress could be, anywhere. We want to have locations all over the United States, because we feel like we're not just creating the ideal in one location. We know that we are desperate for this all over the country. The other thing, Todd, that I haven't really mentioned, and obviously you can kind of see it, with our logo, is that we do have a Christian background, and we do promote that. And we feel like that is something that healthcare has kind of done incorrectly, is that we've separated out the faith aspect of somebody's healthcare. So no, if somebody comes in and they're not Christian, or, if they don't have a faith, or if they, are of a different, faith than Christianity, it's not like, oh, well, see you later. It's more just like, great, you meet them where they are, and you take care of the patient. But so many people are desperate to be able to talk about their faith and be able to, like, bring that in, and they're desperate to hear us. The number of times we get told, thank you so much, because I say, hey, is it okay if I pray for you today? Is that okay? Is that all right? And so again, it's not something that we originally, we kind of debated, do we push this out there? Do we do that? And so it's just something that we really believe in, again, in this model, and in healthcare in general.
No, that's great. That's uplifting because, when folks are dealing with healthcare situations, it's some of the most critical time of their life, and they can't
100%.
feel like they've got to suppress something that's so important
That's
to
right.
their being, right? So,
Well,
yeah.
I mean, it's like every hospital has, they have folks in there. They have either a
Yeah.
pastor, or they have,
Yeah.
somebody there that can kind of walk people through this. Gives me chills talking about it, because it's like we see the need for it, but somehow we figured out that we have to, it's like an intellectual divide. Like, it's like your body doesn't do that. Your mind doesn't do that. Right. So anyway, yeah, thanks, Todd. Thanks for letting me talk on that a little bit.
Appreciate that from the heart. So you mentioned your team. You've got the luxury right now of
Yeah.
attracting great talent, but that
Yeah.
there's
Yeah.
still a challenge of retaining folks
Oh,
and
absolutely.
needing to build the team. So
Yeah.
what are your keys to developing and building a team?
Well, I think really, building our team, and, just kind of the way that we attract talent is, we very much tell people, almost try to, like, scare them off in the initial interview of like, hey, we do things very different. And um what we try to do is make sure that everybody on our team has as much of a work-life balance as you're able to do. And again, balance, is that even a thing? But it's more just kind of understanding that. So when something becomes problematic, like when the stress is rising, it's like, well, why is that happening? And what can we do to kind of help negate that? So one of the things that we're actually looking at doing, we've tried to implement some AI into our current into what we're doing currently, because it can be really helpful for things like work life balance. I don't want my providers at home the night before having to read hours of charting and things on these patients that they're getting ready to see. If I can have an AI summary of their previous results and their previous chart interactions, and then of course they do what every good provider should do. If they see an abnormal result and they go and look at it and they say, okay, let me look at this a little bit deeper, right? But if I can take away those hours of at home time by utilizing resources like that, that's really what helps us to retain the folks that are working with us. That, and just really, again, like I said, focus on family first, and really everything else next. So that's been a big key for us.
So a lot of our listeners are business owners, newer business
Yeah,
owners. So
sure.
earlier
Yep.
on their journey as well.
Yep.
Curious, what would you say as your keys to success leading the business, or what do you wish you knew then that you know now?
Yeah, well, I'm glad of a couple things. I'm glad at the beginning that I didn't know how long it would take us to kind of like get to the point where we feel like, okay, we're doing okay. But I'm also really thankful too that now looking backwards, what I've done differently. Well, there's several things I would have really emphasized and dug into more of that evidence that's coming out every day on the benefits to employer groups, for businesses, for their healthcare spend. And I think that's really what has kind of helped us to make that jump, is really just explaining to them the benefits for their employees and the benefits for them, that ROI. Once we made that leap to working with employer groups, we just haven't turned back. It's been awesome to see the growth and just kind of see where our community is kind of wrapped around this model. So I think that's really the one thing that if I could go backwards, that's what I would be telling myself, is like, okay, we've got to get in more employer groups and really just kind of help them to see and understand, because it is a bit of a long-term game for us, Todd. I'm sure you can
Mhm.
kind of appreciate that. It's not like I walk into somebody's office as the CEO and they're like, oh, great, yeah, sign us up, all 100 or all 20 employees. It's like, no, there's a little bit of a time they need to see,
Yeah.
they need to build trust, and so I would have done that a lot sooner had we have known how helpful it would be in our community. But then again, as the nationwide data keeps coming out about it. So yeah.
Okay, yeah. Great. I heard multiple insights within that, right? Because there's being
Yep.
clear on what's your value prop, and right, and
Yep.
then being able to
hmm
convey it to the
Yep.
target customer, and then being clear who the target customer was. So you had that
Absolutely.
in terms of getting down to what's the real ROI for those
Yep.
business owners, right? Whereas
Yep.
at your heart, you're focused on great care, right?
That's
But
right.
yeah,
Because that's really what we're passionate about, right?
yeah.
We're so passionate. I mean, I'm sure you can kind of see it on us, every time that you interact with us. We're so passionate about making sure that, healthcare is top notch. Like the healthcare that we provide is top notch. So then as a business owner, you're like trying to convey that. And you're right, exactly, nailing down my target market and kind of really getting in with them and helping them to understand too.
Great. Our time flies, Erin. So as we
Yeah.
get close to wrapping up here, and we just scratched the surface here today. What's the
Yeah.
best ways for folks to stay connected with you and
Yeah.
Victress and or learn more?
Yeah, so victresshealth.com is a great way of just kind of learning a little bit more about our model. If you are not local to us, we're still happy to answer questions for you. So you can reach out to us. You can reach out to me directly. It's Erin, Erin, at victresshealth.com. And I'll be happy to answer questions that you have. Another great resource if you are across the country and you're just kind of looking or dipping your toe in, hey, let me see if there are any DPC doctors around this way. You can go to dpcfrontier.com, and they actually have a mapper on there, so you can kind of map out, if there are any that are local to you. So we really love using that resource too for our folks that are across country.
All right. So some great connection points. I
Yeah.
encourage folks to check those out. Those will all be in the show notes for folks
Awesome.
as well. So, Erin, so we wrap up here today. What are you inspired by?
Oh man, I already kind of mentioned, we
Yeah.
have patients that come in this morning. It was a patient that had been suffering for years and wasn't really sure, just kind of like just aches and pains and fatigue and couldn't really do her job well anymore. Ended up retiring from her job and come to find out that she's got a mold buildup in her system. And just taking the time to really listen to her and then be able to test and find out what that is. Gosh, we love getting answers for folks. And so it's like now we have a plan. Now we know what to do. Now we can kind of help her to get on with her life. I also love just being inspired by these folks, even as we're interviewing new nurses, new providers, and they're just so anxious to be able to help people in that way and give folks that one-on-one connection. So super inspired today. Today was a great day because it's like you get to see that light again in folks' eyes.
So, well, thanks. You're helping make it a great day for us here as well. So just love the energy, the passion, the commitment, and the direction
Well,
where
thanks,
you
Dad.
and the team are
Appreciate
going.
it.
Yeah.
Yeah, great.
Thanks. So Erin, again, thanks a lot for joining us. And to our viewers, we appreciate you joining us as well. Encourage you to hit the like button. That does help us with cascading the message. And as mentioned before, hit subscribe so you can receive future messages from other inspiring leaders, like you heard from Erin Hazelbaker today as well. So again, check them out.
Yeah.
Really, on the leading edge, providing better care and lower cost solutions for employers here in the region. Thank
Yeah,
you
great.
all.
Thanks so much, Todd.
Yep. I'll have a great day. Take care.